I'm saying we went to record the insert yesterday. Good morning and a very warm welcome to Bonita's House Call here on SABC2. Africa Chipembe, Nimachero. I'm Dr. Victor Ramatisela. Silent killers. Now, this is a group of diseases that produce minimal or no symptoms in their early stages, and yet they are capable of leading to death if left untreated. They are very common in South Africa, although most of them are preventable and manageable. Now, to hear more about silent killers, let us watch this insert.
I'm Dr. Pascaline Quinn. I'm a general practitioner and I'm working currently at IMC Medical Center. The IMC Medical Center is an integrated medical center where we focus more on early detection of early problem in health in patient. Bernice, how old are you? 33, okay. And tell me, Bernice, what is your main concern today?
I'm a bit concerned about heart health. There's a lot of cholesterol in my family. My dad has had heart attacks before, a lot of cardiovascular problems.
Any fatigue?
Yes, definitely.
Awesome. All right. Do you take any medication? Let's go a little bit more on your family history. In your mom's side. Okay. Now, if we look at more stress trigger, any stress?
I'm studying part-time.
Do you smoke or did you smoke in the past?
No.
No, not? Do you drink any alcohol?
I do.
Exercise?
Not as much as what I should.
Any allergy to medication?
To an antibiotic, erythromycin.
And food sensitivity, wheat, dairy?
Citrus, maybe oranges.
If we can talk a little bit quickly about your diet. We just finished with the medical questionnaire, so I'm going to do the medical examination. Bernice, please, if you can come on the scale. Your mouth, ears and throat. We're going to now to take the blood pressure. I'm going to take the blood pressure lying down. Okay, you see that the blood pressure result that we've got, it's a little bit over the limit that we should expect. We've got a systolic of 129 with a diastolic of 90. We will expect about normal 120 on systolic and about 70 to 80 on diastolic. I would like to do a full blood count.
Yeah, even worse, they died in their sleep. Now, please remember to call us on 083-913-4687 with your questions and comments on silent killers. Or you can send your SMSs to Bonitas 33723. As you welcome into the studio, Dr. Richard Notononda, who's a cardiologist, as it were. We are also joined by Dr. Craige Golding, who's an anti-aging and specialist physician. Gentlemen, thank you very much for joining Bonita's House Call this morning.
Thank you.
We are going to be talking about something that is very, very critical in this part of the world. So important, so critical, that in this country, in September, I think it was, the National Minister of Health convened a summit, Dr. Notononda, to discuss non-communicable diseases, which to most instances are, what we are talking about today, silent killers, in preparation for a United Nations conference that was attended by our president, that the minister had to accompany him to. Did you go to any of these?
No, I couldn't really go, Victor, because of other commitments. But I think it was an important summit, in part because for this kind of problems, you really need the buy-in from leaders and policymakers. And I think, both from the point of view of South Africa, and the UN, I think at least for the first time, that leaders in a country and in the world can acknowledge the seriousness, the threat posed by non-communicable disease. You saw with HIV and AIDS, once the leadership, presidents, leaders of the world came together and said, now we have to put a stop to this. You know, the results have been phenomenal. Even in this country, once the government accepted that HIV was the cause of AIDS and then marshaled resources for prevention and treatment, you know, we're already beginning to see phenomenal results.
Indeed.
Yeah.
I mean, the healthcare reforms in this country are driven by a 10-point plan that was developed by the governing party and indeed the National Department of Health and the provinces. And first on that is strategic leadership.
Sure.
Now, if you see the president going to the United Nations to participate in a program and a conference that seeks to give well the direction on how to deal with these conditions and actually encourages the national minister to convene a summit to get all stakeholders into one room and discuss on how South Africa is going to contribute and participate in that process is very exciting. Yeah. Do you have an idea of what came out of that United Nations summit?
I didn't attend the summit either, unfortunately, due to work commitments, but you know, all around the world, we're seeing more and more of these sudden deaths in young people, you know, 40 plus, suddenly dying of a heart attack or a stroke with no symptoms sometimes beforehand. Cancers, you know, osteoporosis even is a silent killer. You can suddenly have a hip fracture, and that can have a high mortality within 6 to 12 months. About 50% of hip fracture patients actually have a high mortality. So, you know, the thing that's come out is that we need to not only manage these conditions better, which we have fantastic specialists for, and also through lifestyle measures, you know, and pharmaceuticals and nutraceuticals, supplementation. All of that can help manage the diseases, these silent killers. But I think what's come out is that people have realized the incidence of cardiovascular disease and cancer in particular, you know, heart attack, stroke, cancer, the incidence it's almost a global epidemic. And as you mentioned, it's largely preventable. You know, with lifestyle change, correct nutrition, moderate exercise, having a good screening to check your cardiovascular risk factors, not only your cholesterol, check your blood pressure, your homocysteine, your inflammatory markers, your hormones, for example. A low testosterone level in a man is associated with a high risk for prostate cancer.
No, we want to get there steadily now. And I can see, because you deal with this every day in your life. Yeah. We want to get there steadily. Now, let us start, Dr. Neto Nonda, by maybe doing a simple classification of silent killers, or as it were, non-communicable disease. How would one classify them largely? And then let us now, as we go into the details of the discussion.
In fact, just before that, Victor, I think that we need to emphasize that from our summit here in South Africa, I think that there were very specific targets that the minister had set for the country to be achieved, you know, in 2025, in 2030. That relates to reduction in alcohol consumption, that relates a reduction to smoking by 20%, reduction in child and maternal death, increment in screening for certain types of cancers, such as breast cancer, complete eradication of certain types of cancers, etc., etc. But I think on the UN side, that at least there is a commitment for more money to be put into prevention and treatment of this non-communicable disease.
Donor funding?
By governments, not donor funding.
By governments,
yeah.
Okay.
And also, secondly, that recognition, you know, that there needs to be partnership, for example, with food and beverage industry leaders. For example, one of the things that the minister committed us to is to reduce salt intake in our food to 5 grams per day, as opposed to the current 8 to...
And he was here a week ago, and he said, when that happens, we actually are not going to feel the difference when we taste the food.
Exactly. So those are very serious commitments, Victor. You remember when former Minister of Health, Nkosazana Zuma, said that she was going to ban smoking We all initially thought, look, is this achievable? Look where we are now. Today, you don't even have to tell a South African to go out.
Proudly,
exactly.
You know, you walk proudly in other parts of the world that you're
Exactly.
South African when you begin to see how people are smoking all over the place, and then you begin to realize the benefits of strategic and political
so
leadership.
I think for me that, that once there is a political commitment by the leadership and the willingness to tackle these conditions, non-communicable disease, in the same manner that we've seen the commitment to tackle HIV and AIDS, there can be no doubt that in another 10 to 15 years' time, we will see a dramatic reduction in this condition and an improvement in the current life expectancy in South Africa and globally as well. Bear in mind that a lot of these conditions are killing 60% of the world population, but especially in Africa and Southern Africa, they are killing 80% of our people, responsible for 80% of our death annually. So these are serious conditions.
We cannot sit idle while Rome is burning.
These are very, very serious.
Do you want to classify them quickly before we go to the ad break, the silent killers?
Yes, I think it's, in terms of incidence, it's probably best to classify it that way, because the most prevalent is cardiovascular disease, heart attack and stroke. Secondly, I would say cancer. So these are very prevalent and preventable, as we've mentioned. So those are very important. And then there's others, like diabetes, for example. You can have diabetes for many years before it's recognized if you're not screening yourself. And this can affect your kidney function. It can cause sudden heart attack. It can cause eye problems. It can cause vascular problems, peripheral artery disease. Osteoporosis, as I said, is another silent killer that's underestimated. It's really important to know that your bone density, your blood vessels are healthy, and that you're doing the best you can with your nutrition, lifestyle, supplementation, and so on, and drugs when needed to prevent these conditions. And if you don't have your annual check and thorough investigations, you're being silly, because when you pick these things up early, it's so easy to prevent these diseases. And if you just leave it and walk around, and as you've mentioned, that they're silent killers, you often don't have any symptoms. You can just drop dead one day, from a heart attack. And a couple of 100 people every day in South Africa die from cardiovascular disease. And the stats would suggest that more than half of these people are younger than 65. So these are young, active people, and we don't need to lose, these people.
Who could be contributing to society and to the economy in general. Okay, the hoja Sesotho se re lefu le qole nyakobo hona le matshwao a mangata a supang ho ba teng ha mafu a mangata bothata gore ha ke re a tsotella hore hona le mathata kapa kana kong ha re tsebe le hore matshwao ana a supa hore sona lefu le se le o kena ka mahlakoreng jwale hlatsa ba mamela he ngwaneso as we will continue our discussion on silent killers hanganga re khutle papatsong ha re matheo dula rona. Re thobela o lena gape ka mogae mama tla re tshwarang le taba e o tla khwetsa motho a no sepela fela gore no tlhokofala fela mme a sa kula le ga go rwana le sebaka go ba motho le re a no wa phara le re le khwetsa le rawa e se chaile ke moka e sa tlhokofetse se ka le bala go tshwara ka motata mo nomorong ya 0839134687 khotsa molaetsa wa boripana SMS ang kerwa bana Depositas 33723. But before we continue our discussion, let's launch this report on some of the tests that can be done to identify some of the silent killers.
Morning at Ampath Lab, we're at Pathology Lab. We're going to draw bloods on this patient.
The patient is here for an endopad. It is a machine where we determine whether there's any pathology in the endothelium of the blood vessel. It's the very inner layer of the blood vessel. Now the index finger, please. And in the hole there. The next test we're going to do is a tonometry. It measures the pressure of the fluid inside the eye. Let's go through to the stress room so that you can do your stress ECG.
Okay.
Thank you, that looks nice. Your resting pulse rate was 80 and the target that the machine worked out for you is 164. So that would be the pulse rate that we would work to when you do your stress. And we're going through to the next room for the body composition test. The next test we're going to do is an oxidata test. We'd measure the free radicals in the blood. Finally, we are at the last test. We're going to do a body composition that gives us the percentage body fat, lean mass, body water in and outside the tissue cells, as well as the body mass index.
Bernice, I've got some of your results back. Your ECG, resting ECG, was normal. We also did with you this specific test, which is very accurate for detection of endothelial function or dysfunction. And the test that we did with you definitely show that you are at risk. Your body composition definitely also show that you need to exercise more. To prevent silent killer disease, I really suggest that each of us should take responsibility and should definitely go and see his or her doctor.
There we go, there we go. A very important matter. Now, if somebody were to rush to town or to a funeral or to some function, Dr. Netononda, and they've been watching the show up to now and they need to leave, what would you say in one sentence is the best way of preventing silent killers?
The important thing is to be checked, and some of the
Screening.
And some of the screening, it's so simple, really. I mean, to have your blood pressure checked, to have your sugar checked, if you are a female, to have your breast checked annually, to do a pap smear annually, and now, of course, you know, I think it's a very important to also have your HIV checked.
I see.
So, because even though it's an infectious disease, it can, in most cases, lead to non-communicable disease, such as cardiomyopathy and heart failure. It can also lead to heart attack from narrowing of the arteries.
HIV?
HIV, yes. It causes inflammation of the arteries, you know, the aorta and the coronary, leading to heart attacks as we know it.
Are you beginning to see this at
We
Baragwana?
see that a lot. If you see a young person who comes with a heart attack, who's a non-smoker, with no high blood pressure, with no diabetes, with no cholesterol, with no obesity, the next thing you need to worry about is the possibility of HIV driving that heart attack. Very important.
Oh,
So I would say that get your BP checked, get your sugar checked, get your cholesterol checked, get your weight checked as well, because that's another silent killer. Obesity. In this country, 58% of our women are obese, and close to 30% of our men are obese. And obesity drives some of these other conditions, such as high blood pressure, high cholesterol, that contributes towards heart disease.
But before I go to Dr. Craige Golding here, whose reason for existence is to do exactly that, you know, dealing with silent killers. But when you look at South African men, I mean, a lot of them are not very big, you know, so that you could describe as big and obese, but quite a significant number, and disturbingly younger people now, Mukaba.
With the tenders and the BEE, yes. Please,
I
people
didn't
must
say
go
that.
to the gym and stop, you know,
And
the
they
beer belly.
don't consider themselves obese.
Exactly.
Yeah. Now, how do you want to deal with this?
Exercise.
Is it dangerous to have
It is dangerous. We need to watch what we eat. You know, the fast foods, you know, that we often give to our children. You know, obese children become obese adults.
No doubt.
The television, the gadgets that we buy for our children. You know, my son always mourn. I hardly ever buy him a gadget. I buy him a book and a football or a rugby ball.
Yeah.
And there's a very good reason for that. You know, I don't want to see children sitting in front of television with gadgets and playing, you know, with Blackberries and all these things. They need to go out there and play, just like me and you used to play.
Physical
They need to
activity.
increase your physical activity. Increase your physical activity. Mother's there and daddy's there at home. Prepare lunch, cook food. Don't buy fast food for your children as a scarfty, you know, to go with to school, because those kind of things leads to obesity. Another problem we have is the cars that we drive. We're becoming like Americans. We, the adults, we don't want to walk. You know, we don't want to cycle. You know, those kind of things are very helpful. Victor, since I came back from England, I've put 3 kilograms.
Because you're cycling in England to
Yeah,
go to work.
I know, look,
you're
exactly.
walking
In
to
England, I was not allowed to drive my car to hospital. I had to cycle. But here, you know,
Yeah,
there's, now that safety and security, hopefully it's improving, really people should walk, people should jog, people should cycle and get off their cars. South Africans are very obsessed with their cars.
Too many cars.
Exactly,
Too many cars.
yeah.
Dr. Craige Golding, you run an integrative medical center. Your job is to try and prevent people from dying to the extent possible. You actually go to the extent of calling it anti-aging. Is this because there's a recognition that the older you grow, the more the chances of dying from silent killers?
Absolutely, and we're seeing it, as we've pointed out, even at younger ages, that we're seeing more breast cancers, we're seeing more cardiovascular disease due to poor lifestyle choices, stress, poor nutrition, and not having yourself screened, as the good doctor has suggested. So yes, aging is really a huge factor in terms of chronic diseases and silent killers. The older you get, particularly after 40, you know, these silent killers become very, very
What
prevalent.
exactly happens when you get 40? Some of us are
What happens is you start getting hormone decline, your metabolic rate changes, so your risk starts going up. For example,
and
as I
all
mentioned,
of those predispose you to medical conditions.
Absolutely.
Silent killers.
You're gaining weight generally after 40 because your fat metabolizing hormones are decreasing. Often your testosterone level starts to go down. That increases your risk for not only prostate cancer, but diabetes, heart disease, all these silent killers. So you really, even at a younger age, but at least at 40, you need to be starting to be more proactive, to do screening and preventive screening to prevent these diseases from happening. And it's really not difficult. You can do the basics, and then you can even do more extensive testing that we do at IMC, you know, the Integrated Medical Center. We do tests like EndoPAT, for example, which will check your endothelial function. We can just show this, for example.
Just explain what that means.
This is just an example of a healthy blood vessel where the blood will flow straight through without any problems. And this is a blocked artery where you've got cholesterol deposits that we call atheroma in the blood vessel wall. And you can see these red blood cells can't get to the target tissue because the blood vessel is completely occluded. Well, nearly completely occluded. If it occludes completely...
So if you've got an organ that the blood is supposed is trying
like
to get
the brain
to
or the heart, for example,
then you've got a problem.
Then you've got a major problem. But at this point, we need intervention. You know, we may need a stent put in. We may need aggressive treatment of the blood vessel wall. When it occludes completely, then you obviously have your heart attack or stroke because then there's no blood supply to the tissue. So it's very important to know the health of your endothelium, for example. So we check that at
So the endothelium is the lining of the blood
lining,
vessels.
yes.
Yeah.
And that's where you get a tear, and then you get cholesterol deposited in the blood vessel wall, which then eventually leads to occlusion because of inflammation and so on.
So before, let's do this now. So it means screening is critical for us to identify the various silent killers.
Absolutely.
And screening would involve, in essence, proper history taking.
Yes.
Where you look at the person, what they eat, the psychological profile, their family history, and all of these things. Because from then you can determine the chances of them suffering from certain conditions, which you can now actively go and test for.
Exactly.
But
and
after screening, you do an examination.
We've got more and more diagnostic tests at our disposal now. For example, there's great preventive imaging that you can do. You know, companies like Scan for Life exist. There's great imaging that we have available to detect these diseases much earlier than once it's developed. I always make the analogy or the comparison to servicing your car. You service your car regularly. Why? Because you don't want your car to break down. And that's the same story with the body. We need to service it regularly, have it checked, have a good mechanic, the doctor, have a good overall look at you, and do your blood work, do your other labs, and then these diseases can be prevented. It is far easier to prevent a disease, or you know, people are obviously very cost aware, and it does become expensive if you need 3 or 4 supplements and lifestyle change. You know, they sometimes complain about the cost, but the cost of the actual disease, once you've got the breast cancer or the heart attack or the stroke, is way more than the cost of actually trying to prevent it. And also the quality of your life is so much better when you're on an active path of prevention. You feel better, your energy levels are better, your weight is better. And we were talking about weight and obesity. That is a global epidemic. I've recently been to the East. I thought it was a Western problem with American and South Africans. Even the Eastern people are starting to gain a lot of weight. For one reason, it's our bad nutrition and lack of exercise, but another is actually environmental toxicity. We've got such a toxic world that we've created as human beings.
And it causes obesity?
It causes obesity.
How so?
Because your body can only store toxins in fat cells to protect you. Your body is designed to protect you from dying. So we're getting fatter because of toxicity, heavy metal toxicity. Pesticides, for example, on our vegetables. These are hormone disruptors. They not only increase your risk for breast cancer, they're also contributing to obesity and poor detoxification.
The body's attempt to protect us from these toxins is to create more fat cells.
That's right. The solution to pollution is dilution. So you dilute the toxicity in your body by making fat cells where these toxins are stored. So toxicity is a major thing. So we at IMC, we also do toxicity screening, and we do a lot of detoxification. And that's all part of health and wellness.
Okay, when we return, we'll continue our discussion on silent killers. You stay with us. It's getting more and more exciting. Welcome back. You're watching Boditas House Call here on SABC2, and today we are discussing silent killers. Dr. Netonond, before we went to the end break, Dr. Golding here was explaining to us exactly what are some of those things that need to be done. And we'll go back to some of the things that now have to be done to mitigate the risks of toxicity and all the other things that are making our bodies more and more vulnerable to silent killers. But listen to him, and he's got a practice in the middle of Sandton and everywhere else. You'd get a view that these things are almost a preserve of the elite or of a certain class that can afford to pay for certain things, and therefore maybe the majority of the people in South Africa don't get access to these kind of things. They don't get access to screening, don't get access to some of the interventive measures that he's spoken about, because clearly they're quite expensive. Your comments?
You know, it's prevention. It's cheap. You know, you don't need to have a gym subscription to exercise. You can exercise at home. You can, if you are young, you can join the local football club. If you are a student at school, at university, there are sporting facilities. If you are at school, there are these physical excursions in any school. And I will encourage our government, our Minister of Basic Education now, let's go back to the old days where there used to be sporting was part of schooling activity.
I think the Minister of Sports and Recreation has also been pushing for this.
Because
the reintroduction of school sports.
Yeah. Exercise not only reduces obesity, exercise also in a way detoxifies the body. You know, Victor, you go to the gym. You feel good the morning after gym. Your mind is as sharp as ever.
No, indeed.
You know, and that's not expensive. You know, it is not expensive to go to your GP as a man to have your prostate checked.
Now you're talking.
To go to the clinic, to the local clinic. We need to empower our clinic. Yes, particularly African men.
But are all of these things available out there in Lusikisiki, in Kobo, in Malakwari?
The clinics are there, Victor. And the call on government, on Minister Motsoaledi, is to make them work effectively. We've got what we call primary health care nurses who are trained and can be trained further to do things, you know, breast examination, for example, for women. You don't even need a doctor or nurse to do. You can be taught to examine your own breast when you bath. You know, even rural women can be taught, because one of the things that I want to just emphasize that my colleague here has mentioned is that, you know, it's very cheap to do prevention. It's still cheaper to get a growth early and remove it and cure it. Most of the cancers nowadays, if you really get them early, remove them, it's almost cured. It's more expensive, it's often deadly, you know, when things are left late. And some of the cancers, prostate, for example, you know, by the time you can't pass water, it's often too late. Colon cancers, for example, that also do need screening, especially where you know, your mom there's a family history that your mother, your father, your uncle had a cancer of the colon, you know, cancer yamala. You need to be checked. Because these things, hey, they are fatal. And if you get them early, you know, it can be removed. Yeah, you can be cured.
Let's take Kelly. She's joining us from Velcom, Free State. Thank you for joining Bonita Sounds Call. Good morning.
Good morning, Doctor. How are you?
Good yourself?
I'm good, thanks. I just wanted to inquire about blood pressure. What is normal blood pressure and what do the numbers mean exactly?
What is the what?
What do the numbers mean?
What does the number mean?
The numbers mean.
The 120 over 80, what does it mean?
Yes.
Yeah, I've already told you what it is. In fact, it should be 120, 80 or less. And the number simply means...
But not very less.
Yeah, I mean, no, sure. But we want it to be as low as possible.
Okay.
The number simply means, you know, the one is the systolic pressure, which...
Can you see the picture? There's a picture that shows us blood pressure, that can show us blood pressure. I think that picture number 3, I think it was. Yeah, okay. There was explain in the meantime.
The one is the systolic pressure, the top one.
Yeah.
And the bottom one is the diastolic pressure. It is the top one which is particularly important.
Okay.
And as you get older and the arteries get harder, the top measurement...
This is the picture, yes?
Exactly. The top reading...
There was another picture, sorry, distinguishing between systolic and diastolic.
Okay.
There we go.
This one, yeah.
Yeah. That's a bit difficult to discern from it. Basically, the systole part, it's during contraction of the heart when the vessels distend.
Okay.
And the diastole is during relaxation of the heart when the vessel, recoils back to normal. In simplified, systolic pressure is at the peak of the distension, and diastolic pressure is when at the plateau of the recoil. Right. But it is the systolic pressure which is particularly dangerous because that is what drives the damage that blood pressure causes to blood vessels.
So blood pressure, now that we are talking about it, the biggest problem with blood pressure is what you and I would refer to as end organ complications, because the organs that take the brunt of high pressure is the heart itself, the kidneys, and the brain.
Yeah.
And all those can fail as a result.
Exactly. It is the premier silent killer because, you never know that you've got it. There was this myth that when I've got headache, especially in the black community, then it means kinale blood pressure. Exactly. Exactly. No, you can't. You simply can't. You need to go to your doctor or to your
there is
local
no way
clinic.
of telling
There's
that
no
you've
way.
got high blood pressure.
You must get checked. You must get checked. Particularly as beyond an age of 40, as my colleague has said, make it a habit of going to your doctor at least once a year.
Okay.
Get your blood pressure checked. Get your prostate checked, for example. Get your sugar checked. Okay. Because these things, it's like a corrosive effect of as we grow, of the toxins, some of which are self-inflicted, like smoking and alcohol, for example. You asked earlier on, do I have to go to Santen? No. If you don't want to get lung cancer or tongue cancer or larynx cancer, simply don't smoke. Because if you smoke, you'll get those cancers.
Dr. Craige Golding, now these days, we have a lot of health days. Some of them are organized by the Provincial Department of Health, sometimes the National Department of Health, sometimes various companies have these on their premises and the workplace and everything else. If you walk into any of those, and that's all you can afford by way of interaction with the healthcare services, and they have all those screening tests that are available, which ones would you say are critical that one should do when you land on such occasions?
The irony is that the critical ones are actually so affordable to the masses. So blood pressure, it costs nothing to have your blood pressure checked.
Blood pressure, one.
A glucose check, your sugar check, a cholesterol check.
Cholesterol.
Check. In a woman, at least examine her breasts and preferably get a pap smear done. In a man, at least get your prostate examined, and then listen to your body, listen to the symptoms. But those handful of simple, cheap tests are incredibly helpful to prevent a lot of these diseases.
Between cholesterol and hypertension, which one kills more South Africans silently?
That's a tough question. I would say cholesterol, but if you're saying kills it silently, possibly blood pressure, because people do have their cholesterol checked. and perhaps we're not focused on checking enough people with blood pressure. So it is probably a more silent killer than cholesterol.
In the African community, is it your
cholesterol.
view that we're checking cholesterol as often as we should?
Well, let me say this, Victor. The blood pressure is more profoundly damaging to the arteries that goes to the brain.
I see.
And leading to stroke. Whereas cholesterol is more profoundly damaging to the arteries that goes to the heart and cause a heart attack. So in the African community, over the years, the premier eventual manifestation of high blood pressure would be stroke and kidney disease. Whereas in the white community of South Africa, the premier manifestation of cardiac disease in a way would be heart attack, which is driven by high cholesterol.
Why the differences?
Well, I think that's in a way the difference impact of these factors, high blood pressure on the one hand and cholesterol on the different vasculature, the one going to the heart, the one going to the...
Is it lifestyle or is it matters heredity and matters...
It's a combination.
Okay.
It is a combination.
Okay, let's stop at that. Let's stop at that. We'll continue our discussion on silent killers after the break. You stay with us. Welcome back. One is to such a lapelaka salet Simon Bonita's house call for SABC 2. Now, many years ago, Dr. Golding, I had a discussion with one of the leading professors in this country, a leading health commentator as well. I won't mention his name, but I'm sure when I make the comment, you'll know exactly who he is. He says there is no need for us as human beings to be taking supplements and vitamins and those kind of things because all they do is to produce expensive urine. You have a different view?
I have a completely different view, as you well know. I'm very pro-supplementation, and there's a number of reasons that I am. Firstly, our soil doesn't contain the minerals that it used to do. So the quality of our vegetables, or the nutrient content of our vegetables and fruits and
just
foods...
before we go, you are pro-supplements?
Yes, of course.
Okay. What are supplements?
Well, supplements are, tablets or nutrients that you take in addition to the foods that you eat.
I see. Okay.
So there are a number of reasons why the world actually has become more aware that we need to do that. Particularly the last decade, you'll see more and more people are taking supplements than a decade ago. And I'm just explaining some of the reasons. Our soil is depleted in the minerals. Once you pick the vegetable or the fruit, it already starts to lose its vitamin C content and its nutrient content. Then it gets transported, it gets stored on the shelf in a supermarket, or it gets frozen in the deep freeze. All of this depletes the food of our nutrients. So we're not getting enough nutrients from our food. And many people are not eating enough vegetables and fruits. They're relying on these fast foods, convenience living, and invariably we don't get enough nutrients in our body. So in my practice, I've done a little study on about 1,000 people to check the vitamin D levels. In our hot climate, we're still seeing 80 to 90% of people are suboptimum in their vitamin D. So a lot of people need to supplement their vitamin D because they can't spend too much time in the sun because most of them are office bound and working.
And all of these deficiencies make them vulnerable to disease.
Absolutely. Vitamin D, for example, it's probably the most important vitamin to prevent cardiovascular disease and cancer and osteoporosis, all of these silent killers. So I put a lot of patients on vitamin D, for example, as a supplement. Omega-3, very powerful anti-inflammatory, very powerful to prevent cardiovascular disease. So these kinds of supplements...
What is this omega-3? I mean, you find it all over the place now, in the chemists and everywhere. What is this omega-3?
It's an essential fatty acid, but it's very, very helpful for almost all diseases, prevention and treatment, because a lot of these diseases are caused by actual inflammation. Coronary artery disease, this cholesterol deposition, we looked at this model, it's driven by inflammation. Cancer is driven by inflammation. So what we want to do is be in an anti-inflammatory state. That's why the foods that we eat, the fast foods, they promote inflammation in our body. Eating healthy fruits and vegetables, they're full of antioxidants and anti-inflammatory type agents or anti-inflammatory responses in the body. So to keep inflammation down in your body is critical to prevent disease. So omega-3 is very high on the list. It's an essential fatty acid. which means you need to get it in your diet or you need to supplement it. So unless you're eating fatty fish like salmon, which is expensive every day or 3-4 times a week, you're not getting enough omega-3.
So you'd encourage an average South African to be taking one form of supplement or another, and how do you determine which one and how much?
Well, we do nutritional panels to see where they're at with their nutritional status. For example, we would check their iron and their B12 and their folic acid and their protein. Vegetarians, for example, because they're trying to lead a healthy lifestyle, are often B12 deficient or iron deficient or protein deficient. They often don't get enough protein, and then they need to supplement these. So we do a nutritional panel, we do a hormone panel, and we do a detoxification panel to see how toxic they are. Because there's a lot of nutrients that you can use to detoxify. Milk thistle can protect your liver, for example, for that glass of wine that you might enjoy. And also because your liver is detoxifying your body all the time, is one of the major organs of detoxification. So we check the liver functions, for example. If the liver enzymes are elevated, or if you're overweight, you're very prone to a fatty liver, and then your liver doesn't detoxify as well as you can. So these nutrients and supplements you don't get in your diet.
So it's not a luxury in the end.
No, I would say omega-3 vitamin D and multivitamin daily, most people are actually needing, because our foods do not contain the nutrients. And also, it's in our hectic day-to-day living these days, it's very difficult to get your 5 to 9 fruits and vegetables in. So most people are not doing it. So supplementation, I think, is very important.
Quite interesting. We'll get into the details of that a little bit later there. Joining us from PLK, Polokwane. Lebo, thank you for joining Politics House Call. Good morning.
Morning, doctor. How are you?
Good yourself.
I'm well. I've got a question for you.
Yes.
Is pre-diabetes a silent killer?
What?
Pre-diabetes.
Pre-diabetes?
Yes. And how is it different from impaired glucose tolerance?
These people who go into the internet label, where do you get all of these things? You are complicating our life. But Dr. Neto is a specialist in the area. Can you answer label for us, please? Pre-diabetes and
very good question
tolerance.
from label. When a person becomes eventually diagnosed as a full-blown diabetic, it's almost 10 years that they've been in this pre-diabetic state. And usually, exactly, that's why it is a silent killer. So when you go to the doctor or to your clinic and they say, we've checked your sugar before, fasting sugar, and it indicates that you are now diabetic. 10 years has passed that you've been in this pre-diabetic state, which is as dangerous in terms of damaging the blood vessels and the organs, such as the eyes, the kidneys, the brain. It's as dangerous as full-blown diabetes. Yes, a pre-diabetic state is the initial period before you fully diagnosed as diabetic, that your sugar control system has been dysfunctional. And it's driven by things such as obesity, for example. Obesity, drives in part the pre-diabetic state. You asked the question before whether are these things hereditary, are they acquired? You have a blueprint to develop diabetes or high blood pressure. It may show without you gaining weight, but usually as soon as you gain weight, it shows off.
Why is it so difficult for people to lose weight?
Well, for a number of reasons. I think number one is lifestyle. So they're not making the right nutritional choices. Although people are more educated. Eat a lot of rubbish.
Wrong stuff?
Yeah.
Oh, you call it rubbish? Okay, that's fine.
We eat a lot of wrong stuff.
Yes.
So nutrition is number one on the list, making that change. And then the exercise. It's hard for people a lot of people just don't make any effort to do the exercise. They'll rather take a pill to try and lose weight, which is really not the way to do it. You need to do it with lifestyle change. And then, as I've mentioned, environmental toxicity is certainly contributing to weight issues. And aging is a big problem with weight, because your fat metabolizing hormones decline, like DHEA, for example. Your testosterone level declines, your metabolic rate declines, and you do gain weight as you age.
But why do you find people who can eat as much as they want for as long as they want, and they never get fat? And you got those who just have to eat a little bit more. Like now, we've just come from the festive season. Some people just ate a little bit more, but now they've ballooned. Why do you find those?
There's a lot of reasons for that. Our resting metabolic rates differ. So some people have a very high metabolic rate, and can metabolize many more calories than another person who has a very
that's
slow
purely
metabolic
natural,
rate.
That's purely natural. You cannot do anything to increase the metabolic rate?
Oh, no, you can. There's things like T2 and 7-keto and various other supplements that can improve your metabolic rate.
Okay.
And then there's other factors. You know, some people are prone to an underactive thyroid, which will affect them from losing weight.
And they might not know that they have
They may not know.
thyroid.
They may have a low T3, for example, which is one of the thyroid hormones. Very important. Low DHEA. And they may not realize it. And they're exercising, they're eating well, and they're not managing to lose weight because they have a hormone deficiency. And just to repeat, the toxicity, you know, is stored in fat cells, the toxins in our body. So I think environmental toxicity is a big one, and I think we should be paying attention to it. You know, we do a lot of work, as I've said, on detoxification of patients in our practice as part of our anti-aging strategies to keep the body as pure and clean as possible. But our environment, we need to clean up. We're destroying our planet.
Why would silent killers be more prevalent in Africa and the developing world? You'd have thought that these kind of diseases, as we describe them, are more related to lack of exercise, obesity, which are things that one would think are more associated with the developed world, with the high socio-economic status. Why in Africa and in South Africa, and certainly certain parts of South Africa, where there isn't a lot of money flowing around, you get a lot of these conditions?
It's related to poverty.
Poverty makes you fat?
No.
Oh, okay.
Poverty goes hand in hand with illiteracy, with ignorance. You know, whereas you know, when people are relatively well off, they
have more choices.
They've got more choice. They've got access to information. For example, they can choose. You know, they've got more choices.
Well, it's well said. But kusobala ukuthi ngaphandle kokuthi sizihlole njalo ngeke sikwazi ukuhambula izifo eziningi ezimshosha phansi la ezibiza ngama-silent killers esizenzele inkinga esikhathi masiloko sihamba. We'll round up our discussion, of course, on the discussion of silent killers when we return from the break. Stay with us. You're watching Politics House Call here on SABC2, and welcome back. Dr. Netherland, how would you part with the viewers and I about today's discussion? What would be your key message?
For me, prevention is better than cure. Get your blood pressure checked, get your cholesterol checked, get your sugar checked. If you are a woman, get your breast checked, examine your own breast, do a pap smear, and it's important that this is done quite early for women, especially where there's a history of cervical cancer, there's a history of womb cancer, because these things run informally. And much more importantly, I would urge medical aid schemes in this country, treat high cholesterol the same way that you treat high blood pressure. Medical aid schemes are ignorant, refusing to pay for treatment for cholesterol for patients, as if cholesterol is less of a killer than high blood pressure. Both these conditions are similar killers.
Thank you for that. We'll definitely communicate that. We'll actually have a discussion around some of the exclusions that medical aids have that doctors and other healthcare policymakers think are critical. Yeah. Dr. Golding?
Well, I agree so with what's been said. I would say prevention is the medicine of the millennium, and we certainly need to be more focused on it. You know, as doctors, we trained at medical schools, especially physicians, but even general practitioners, we trained to diagnose disease and treat disease with chronic drugs. We're not trained about prevention of disease, and that's what's come through the last decade or two. And we really need to be focused not only as doctors about preventing disease, because that makes you a better doctor if you prevent your patient from getting a disease. As people, we need to be good doctors to ourselves and make the necessary lifestyle changes. If you're not pro-supplementation, eat properly. You know, choose your nutrition very carefully and concentrate very carefully on what you put in your mouth, and do your exercise, and do your de-stressing, and do your detoxing. It's up to you. You can be your best doctor yourself.
Dr. Craige Golding, Dr. Richard Nitsunoda, thank you very much for joining. But certainly food for thought, but it is something that you need to revisit from time to time. Mzikama wenda unandawo kumakhaya namakhaya siyanibulala nonke enitheni asigquba ndasithi umhlana kule ntsasa yanamhlanje sithi yanga nangamso. We'll be back next Saturday with embarrassing medical problems. Hey, don't miss it here on SABC2 at 9 in the morning. Arkopaneng hape bekengetla tato highly amrena. Thanks for joining us today. And for me, Dr. Victor Ramoresi Ramatisile, ya khawla yaya, namani tsetla mutaumamlezan. You take care.